Here's a paper. The title is The Effectiveness of Hypnosis for Pain Relief, a systematic review and meta-analysis of 85 controlled experimental trials. So again, 85 controlled, so meta-analyses, what these are, and what a systematic review is and what a meta-analysis is where they're not collecting raw data themselves, where they're going back to the literature that's already been published and looking at the data that has already been collected. And in meta-analyses, systematic review is sort of taking all that data and summarizing it and coming up with a conclusion based on the data that has already been done. A meta-analysis actually tries to get the raw data from those studies and it sort of tries to pool it and tries to do a statistical analysis on that pooled data. Okay, so let's say you had 5 studies of some pretty unique situation or some pretty unique diagnosis, and each study had 10 patients in it. And each study showed a certain result from those 10 patients. And when you publish your study, you publish the data, you publish the results and your discussion. And oftentimes what you'll see at the end of the study is, our study was limited by the number of patients we enrolled. However, this suggests that future studies should be done with higher numbers of people to increase the power of the study, et cetera, et cetera, et cetera. But it is trending towards this, and it is showing this. Okay, so it's not. I don't hold those studies back, and so we want to put those out there so that other physicians or clinicians or therapists or people can see that and go, oh wow, this person thought about this, and let's try to advance this further. And that's kind of how I see science working. And so what somebody might do is they might come along and say, let's study how many people might actually benefit from hypnosis. And so they go or whatever this treatment is that we have 5 studies of 10 people, and they say, okay, let's collect all the data from these 5 studies and put it together. And can we actually look at this and analyze it as if we were doing this study on 50 people, right? So now you just took 5 studies of 10 people, and now you have 50 people in your study. Okay. And I'm not an expert in this, but it's sort of a statistical, it's a very complex sort of statistical analysis of the data. And they try to summarize it and then look at the data from a different perspective. And so in this study, the effectiveness of hypnosis for pain relief, a systematic review and meta-analysis of 85 controlled experimental trials. Yeah. So what they did is they found 85 eligible studies, and they go into, if you read the paper, it goes into what did they think was an eligible study. And they identified 3,632 participants. And what they found was that efficacy was strongly influenced, again, by hypnotic suggestibility, which is what we were just talking about. Okay. Specifically, optimal pain relief was obtained for hypnosis with direct analgesia suggestion administered to high and medium suggestibles, who respectively demonstrated 42% and 29% clinically meaningful reduction in pain. That's a pretty significant, so if you are in the high or moderate suggestibility pool, you could have 40, up to 42% meaningful reduction in pain. That was the high group, and then the medium suggestibles were 29%. Even 30% meaningful reduction in pain is quite large. To be completely frank with you, the guidelines for continuing opioid medications, okay, so if you're on 100 milligrams of opioids, if you're on 100 milligrams of morphine, the guidelines state that clinically meaningful improvement is 30% pain reduction. 30%. Okay, what does that mean? That means that if you're at a 10 out of 10 pain, that taking taking the opioid medication decreases your pain down to 7 out of 10. Okay, so if you have a moderate based on their study, right, pooling all these studies together, if you are a moderate suggestibility patient, 29% meaningful reduction in pain. And if you're high, up to 42%. 42%. That's better than some opioids, ladies and gentlemen. Better than some opioids do for people. Okay. So if this is something, for instance, that works for you, why not try it? Right. Why not try to figure out, am I in the moderate to high? I know that I'm definitely in the moderate to high suggestibility. And so it has proven beneficial to me. And what happens is that a lot of times, you go and do a session with a hypnotherapist, and then they can record a recording for you, or a few different recordings for you to do it in the comfort of your own home if they feel like you're safe and able to do so. All right, so that's just from that study there. The next study is another really good sort of summary, and that's kind of what I'm going to go into a little bit. It's called Hypnotic Approaches for Chronic Pain Management, and this is out of the Department of Rehabilitation Medicine from University of Washington. University of Washington has always been a really good program in their Department of Rehabilitation. They've always been one of the leading universities in multidisciplinary care, in comprehensive pain management. So I'm not surprised that this comes from them. The first author, Mark Jensen, he is an author of 2 books. One is called Hypnosis for Chronic Pain Management, a Therapist Guide, and Hypnosis for Chronic Pain Management, a workbook. And the other author, David Patterson, he's published 1 book as of the publication of this, which is called Clinical Hypnosis for Pain Control. Clinical Hypnosis for Pain Control. So you can see, right, there's a lot of researchers that are quite heavily involved in this. From the abstract and introduction section here, hypnosis has been used to treat every type of pain condition imaginable over centuries and across cultures. Right. So I love the practices that have been done for centuries, right? That there's some knowledge, there's some internal knowledge that people have with the practices that is continuing the practice, right? And across cultures, multicultural, right? Multidimensional. To me, it's beautiful. What is new about hypnotic analgesia is the compelling empirical evidence that has emerged in the last 2 decades regarding its efficacy and mechanistic underpinnings, right? So that's the new, is now we can study it using EEG, we can study it using fMRIs, we can do hypnosis while somebody is getting scanned in the brain, and we can see what's changing, right? And so that's what they're talking about new. Much of the earlier research studying hypnotic analgesia focused on acute pain induced in laboratory settings or pain associated with medical procedures. Right? You could argue, childbirth. I can guarantee you, many women hypnotize themselves for childbirth to some degree or other. Whether it was whether it was through guided imagery of some sort, whether it was through using breath, focused attention on the breath, or whatever it might be, that you're altering your sense of consciousness to some degree. And so, you've heard of the stories of people hypnotizing themselves for surgeries, for procedures where they're being cut into, for colonoscopies, et cetera, et cetera. And this has been well known, well studied. This work continues, and there have also been a number of recent innovative applications of this modality to treat acute procedural pain. So that's again the acute. You're having a procedure done, and we're going to try to decrease we're going to try to increase the analgesia by using hypnosis. Other recent advances in understanding have come from the imaging studies examining brain functions associated with hypnosis and hypnotic analgesia. In addition, there has been recent and dramatic increase in research on the efficacy of hypnosis for chronic pain conditions. Clinical outcome studies on acute and chronic pain, as well as neurophysiological studies in the laboratory, have demonstrated that hypnosis is effective over and above placebo treatments, and that it has measurable effects on activity in brain areas known to be involved in processing pain. We're going to look specifically at some of those brain areas. Equally important, recent clinical trials provide significant findings useful to the clinical application of hypnosis for the management of chronic pain. Beautiful. The ensuing review and discussion highlight the clinical relevance of these findings to the use of hypnosis for chronic pain and present the issues that we believe should be considered in future clinical and theoretical work. Okay. So it's a pretty good article here. It gives you a pretty good baseline. Under hypnosis treatment has significant benefits beyond pain relief. So you always love a treatment that not only is helping with what you're going in for, which is chronic pain, right? But also spills over into other domains of your life. Okay, like, hey, this helped with my pain, but I'm also feeling like I have more energy or less fatigue, or I'm feeling like there's more joy that has emerged from this. In short, we have found that hypnosis treatment has two potential effects on chronic pain. First, as described above, the treatment can result in substantial reduction in average pain intensity that is maintained for up to 12 months. In some, but not all patients. That's a long period of time, right? How long did your medication work yesterday? 3 hours. We interpret this finding as support for the hypothesis that hypnosis treatment can result in sustained changes in how the brain processes sensory information in subgroups of patients. Right? Remember what we have mentioned over and over again, right? We're looking at how the sensory input is transmitted to the brain, but we're also looking at how the brain is processing the sensory input, right? So if we shift the way that the brain processes the sensory input, you're going to shift your experience of that sensory input, right? So let me reread that sentence again. We interpret this finding as support for the hypothesis that hypnosis treatment can result in sustained changes in how the brain processes sensory information in subgroups of people, right? In essence, one could argue that an opioid changes how the brain processes the sensory information, okay? However, for greater numbers of patients, hypnosis treatment teaches self-management skills that patients can and most do continue to use regularly, and that can result in temporary pain relief. Non-pain related beneficial treatment effects included improved positive affect, relaxation, and increased energy. These non-pain related benefits were reported despite the fact that the hypnotic intervention was script-driven and focused exclusively on pain management. Right? So the script in the hypnosis is focused on pain, but what happened is they found actually non-pain related beneficial treatment effects, including increased positive affect, relaxation, and increased energy. Hey, look at that, right? Bang for your buck. One of the most important findings from recent neurophysiological studies of pain is that there is no single pain center in the brain that is responsible for the processing of pain. We now know that pain is associated with activity in and interaction between a number of different areas of the peripheral. So your spinal cord and the nerves that come off of it, and central nervous system, your spinal cord and the brain, each of which contributes to the overall experience of pain. Okay. So we're not only looking at one brain area, which is why mindfulness and meditation and breathing have been shown to be efficacious in pain management, because we're not just looking at, oh, that's my brain center. No, it's different parts of the brain and how they're communicating to each other. Okay. And so if we start to affect one part of the brain, a self-referential thinking, oh my goodness, this pain is a stroke, or I'm going to lose my arm. Well, that then causes the next part of the brain to be activated, which then causes the fear response and the danger response to go up. And if that is not indicated, then we're essentially modulating the pain based on that connection that we've made of that association of what we feel in our body. Okay, when maybe that's not an accurate association. The cortical areas most often activated during pain are the thalamus, anterior cingulate cortex, insular cortex, primary and secondary sensory cortexes, and prefrontal cortex. The relative contribution of each of these areas to the experience of pain varies as a function of the nature of the pain stimuli. Each of the brain areas involved in pain processing has been shown to respond to hypnosis in more than one study. Hypnosis has also been shown to influence the processing of aversive stimulation at the level of the spinal cord. Thus, hypnotic analgesia appears to influence different areas of the nervous system that are involved in the processing of pain rather than having a single unilateral mechanism. So how cool is that, right? We can actually, by doing hypnosis, we are not only affecting the areas of the brain that are processing pain, multiple of them simultaneously, but we're actually also affecting the spinal cord, which is the tract that helps bring that information up to the brain. In a hallmark study done in 1997, demonstrated that hypnotic suggestions for reduced pain unpleasantness influenced activity in the corresponding area of the brain expected anterior cingulate cortex, but not in the other brains, including but not in the other brain areas, including the sensory cortex. Subsequently, this research group demonstrated that hypnotic suggestion for less pain intensity influenced activity in the primary sensory cortex, but did not influence activity in the anterior cingulate cortex. So depending on the amount of stimulus that's coming from the pain, different parts of the brain are going to be affected through hypnosis. That's cool. Together, these studies indicate that hypnotic suggestion can be targeted to specific effects in brain activity. Thus, not only the hypnotic induction, but the content of the specific hypnotic suggestions is of critical importance to the benefits derived from hypnosis. Right? So you're being induced. There's the induction of hypnosis, which is putting you sort of under, in essence. And then there's the suggestions that occur. Okay. And this is individual therapy. This is the individual therapist that comes into play here. Hypnotic suggestions should target multiple pain domains. So here they're giving recommendations, right? Hey, let's target multiple pain domains. As you're under, let's have the therapist target multiple pain domains. We have already discussed the importance of providing suggestions to improve outcomes other than just pain relief, sleep quality, well-being, and activity level when treating chronic pain with hypnosis. The same principle applies when treatment targets pain relief, because pain is a multidimensional construct with sensory, affective, and evaluative components. Each of these domains can be influenced by hypnotic suggestions. Each of those domains, right, sensory, emotions, and our evaluation of all that, right, our interpretation, our judgment, our criticism, etc., of that, right, those are all affected by the practice of mindfulness and meditation. Clinicians using hypnosis for pain management should target their suggestions to the different brain areas that process pain. Clinicians will likely be more effective if they are guided by knowledge of the specific brain areas that are linked to pain. Some of the pain-related domains that appear to have specific cortical associations include the intensity and quality of the pain, whether it's bothersomeness or unpleasantness, a sense of comfort and physical integrity, reduced threat value and negative implications of the pain, and the ability to screen out discomfort and let in comfortable sensations. Current thinking in pain physiology suggests that hypnotic suggestions should target several of these domains rather than any one of them. How many times, right, in the practice of mindfulness, how many times have we looked at just paying attention to the quality of the sensation that we are all interpreting as pain, right? Being curious about the quality of the sensation, the intensity, the quality, the changingness. How quickly we are to say that it's unpleasant or bothersome, right? Bringing in a sense of comfort, right? Allowing that sense of comfort, finding a place in the body that actually is comfortable. Decreasing threat and negative implications of the pain. Right? How many times do we look at that jump from here's the sensation to, oh my God, I'm going to lose my limb, right? Or here's it from this to, oh my God, I'm having a heart attack, for instance, or whatever it might be, right? So understanding that threat value. Now, sometimes that's important, right? If you really are having a heart attack, we got to get emergency help. We got to get to the emergency room. Okay. But every time I feel chest pain, if I've gone to the emergency room once and they've ruled out heart attack and I've had all the appropriate workup, et cetera, and then I have that same pain and now it's, gastritis related or anxiety related. Now I can say, oh, am I having a heart attack again? And then I can use mindfulness or meditation or reasoning to decrease the threat value, the negative implications of pain. Right? Oh my goodness, I have back pain. In 2 months, I'm going to be in a wheelchair. And then what happens? Right? That causes my spiraling to go out of ability to screen out discomfort and let in comfortable sensations. Right? How often do we open up to comfortable sensations? Right? And we've discussed this as well. Well, we're more programmed to pay attention to uncomfortable situations because we need to determine whether or not it's dangerous, and we need to do something about it for our survival of our species. Right? So I'm more programmed to go towards something that is not right versus allowing that which is right in, allowing the softness, the comfort, the opening that's occurring. Maybe it's just in my pinky toe that I'm feeling that comfort. But if I can find that comfort somewhere, maybe that's where I direct my attention to. Okay. Taking advantage of the cortical calming effects of hypnosis. So they say that the hypnotic induction itself, even before any suggestions are made for pain relief, results in a shift of brain activity in a direction consistent with that of someone experiencing pain relief. Right? So we're almost like relaxing through the hypnotic suggestion. Right? Whatever, if you've ever done this, if you've ever been hypnotized, there's sort of an allowance, there's a letting go, there's a surrendering that occurs. Right? And you're almost sort of surrendering, and then it's sort of like your brain activity decreases with the body. And that's actually part of the relaxation response, the part of the progressive relaxation techniques is you tense your body and then you relax your body. You tense your body and you relax your body. And as your body relaxes, your brain relaxes. It's almost like you're using your body to instruct your brain to relax. Hypnosis is certainly not the only technique that can be used to shift brain states. We know that, right? Which is why we're covering this in a mindfulness and meditation class, right? Some clinical trials comparing hypnosis to relaxation training have failed to detect differences in outcome for these two treatments, at least for headache pain relief. So if you're interested in continuing to read The paper is titled Hypnotic Approaches for Chronic Pain Management, Clinical Implications of Recent Research Findings, and it's by Mark Jensen and David Patterson out of the Department of Rehabilitation Medicine from the University of Washington. But you can see, right, how all the literature, the research literature really supports this sort of practice, whether it's hypnosis, whether it's relaxation, whether it's mindfulness, whether it's breathing, whatever it might be, that by doing these practices, we're not only decreasing the stimulus from the injury, but we're also decreasing the way that the spinal cord and the brain are transmitting the information and processing the information, right? That is divine. That's incredible. That's amazing, right? Now, if we are directing that, using our attention towards stress, anxiety, and trauma, then that's what we are going to be repeating in ourselves. And each repetition of that becomes then a memory, and that actually causes more stress and pain. Okay, so when we do these practices, it's important to really use that, really use the rip-rap analogy, right? What is your intention and where is your attention? What is your intention and where is your attention? Because wherever, as we place our intention on something and then direct our attention to it, then that's creating these changes in the spinal cord and the brain. Okay, and so that's why in a lot of our practices, right, we start by trying to find a comfortable position, as comfortable as we can find, recognizing any stress or tension that's in our bodies, trying to release it, even just the intention of the release, even just the intention of relaxing. And then finding a place that we can direct our attention to that is healing, that is growing, that is expanding, that is in a direction that we want our attention to go to. And that's the manifestation. That's the practice. And can this be challenging? Absolutely. Right? Because maybe we've got, itchy skin or a severe back pain, neck pain, a diagnosis of cancer that we're going through treatment for, a loved one that we're very concerned about, a pet that is, that recently passed away or is sick. And so that's where our attention is going to. Concern, right? Worry, fear. Oh my goodness, what is this? And recognizing that and not resisting it, but being aware of it. Being aware of that and saying, okay, I'm aware of that. Now, where can I, because if my attention goes here, I'm going to go into this rut. If you want to go there, right? Fine. Right? But if we want to try to kind of like navigate this, then it's, look, I've been there before. I know what that's like. Well, now you're actually getting to a point where maybe you can actually have a choice. And so it's like, look, I've been in that rut before. This is what happens. It's not pleasant. Sometimes I need to get hospitalized, whatever it is, right? I've been there. Can we go a different direction? Can we go a different direction with my attention? And it's not that, all of a sudden, all of a sudden your pain goes away or anything like that. But can we just go in a different direction from where our attention is going, which is a direction that you are trying to choose, and you're setting the walking stones up so that you're seeing a path in front of you of, this is the way that I would like my attention to go. And recognizing, yes, my attention is going to get caught. It's going to go away. It's going to be driven into this rut occasionally, possibly. And then coming back and saying, oh, okay, here we are. Now, what's happening right now? And where am I going with my attention? Where am I going with the way that they put in these papers, suggestibility? It's a loving suggestion to your entire body, to your entire system, to your entire body, mind, and spirit to go in a certain direction, right? And this is, this is going to be, in my opinion, sort of the advent. This is going to be the future, because, trying to find medications, trying to find energy systems, trying to find whatever it might be that allows us to open up the suggestibility of our system and then direct it in a certain way, right? And the key point is going to be, how are we directing it, right? How are we guiding it? And this is why, one of my old mentors for mindfulness always said, you're shepherding the mind. You're shepherding the mind, because the sheep are going down the valley and they're going to go off and here and there. And what you're trying to do is you're trying to collect all the sheep, have them continue, right? Oh, I'm seeing one kind of go over there. That looks like it's a little bit of a dark forest. We'd like our sheep to stay together. Come, right? And so you're shepherding the mind as you're shepherding the sheep going down this beautiful valley, grazing, finding rivers and streams and exploring. But you're shepherding it, right? And where are we going? Well, there can be a path forward, despite the pain, despite the unpleasantness. Okay, so that's why hypnosis is a big part, and is very applicable to pain, and is very applicable to mindfulness and meditation, because in that state of meditation, essentially, is almost like we're like self hypnotizing, right? And then when we have a little suggestion, when there is a little intention with our attention, that's a little suggestion, little suggestibility, right? And that how it works not only on pain but also on these other things, like energy and mood and affect. What a great tool. For today, we don't have time to do a practice, but kind of setting yourself up to do your practice in the next few days, and being open to this fact that by doing this practice, we are actually changing the software in our mind, or brain being the hardware. We are actually changing the software so that our program can run differently. Right? We know how the hardware is running. Now, can we update our software? Can I say, you know what? I'm ready for version 2.0. Well, how do we do that? And it's through this practice.